Scanning around the room.
Oh, I didn't get to smile. Hi.
Hi, good morning. My name is Shanier and I'll be your student nurse today from UOD Mercy. I'm going to close the curtain for privacy and wash my hands. I'm going to check your ID. Can you verify your name and date of birth?
Abigail Tissue 4389.
Okay, do you have any allergies or pain? Okay, patient appears to be her stated age. Patient is well groomed, no signs of any odor or hygiene problems. How are you feeling today?
Good.
That's good. Patient's mood matches her affect and her speech is clear and appropriate for the situation. Do you know today's date?
Today is Tuesday, February 16th, 2016.
And do you know where we are?
Detroit Mercy.
Okay, and do you know who the president is?
Bama.
Okay, good. Patient is alert and oriented ×4. She's conscious. So I'm just going to do a quick head-to-toe assessment on you, okay? I'm going to start with your head. There's no lesions or parasites in your hair at all. And your hair looks good. And I'm going to check your face. Let me know if you feel this. You feel that? Okay, can you raise your eyebrows and smile and poop your cheeks? Cranial nerves 5 and 7 are functioning properly. I'm going to use my pen light to take a look at your eyes. You can follow my pen light for me. Pupils are equal, round, reactive to light and accommodation, and your skin is nice and warm, and color is appropriate for ethnicity, and so your eyes are symmetrical. And I'm going to use my pen light to take a look at your mouth. Say ah. The uvula is midline. Your tonsils are +2 bilaterally, and they're nice and pink. No signs of any lesions. Your tongue has no lesions. Your buccal mucosa is moist and has no lesions. Your teeth are white and straight, and your gums are nice and pink, has no redness, swelling, or lesions, and your lips are nice and moist. I'm going to listen to your carotid, palpate your carotid arteries. Carotid arteries are bilaterally and +2. I'm going to just take a listen to them using the bell. No signs of any worry, and I'm going to take a listen to your heart. Starting at the aortic, the pulmonic, the herbs, the tricuspid, and the mitral. I'm going to listen for the apical pulse for 1 minute here. I'll go back up using the bell of the stethoscope to listen for any murmurs. S1 is loudest at the apex and S2 is loudest at the base, and your heart sounds good. I'm going to just look at your upper extremities. Your skin is nice and warm, no signs of any lesions or masses. If you did have lesions, we would use the mnemonic ABCDE to assess them. And your skin is appropriate for ethnicity, and your hair distribution is good on both arms. And I'm going to check your fingers for your capillary refills. And your capillary refills are less than 3 seconds, which is good. And can you do this for me? No sign of any clubbing. I'm going to check your radial pulse. Radial pulse are bilaterally +2 and equal. Check your brachial pulse. Brachial pulse are +2 bilaterally and equal as well. And can you hold that, grab grab my hand. Thank you. Your hand grips is strong on both hands, which is good. And I'm going to take a listen to your lungs. So take nice in and out breaths. And we do 8 on the front. Do your lateral side. Do your posterior. Okay, your lungs sound good. Listen for 10 positions on the back. And can you lean forward for me? I'm just going to check your spine. Your spine is straight, no signs of any scoliosis. You can sit up. I'm going to check your AP diameter, and it should be 1 to 2, and it is 1 to 2. And you're just going to feel me push a little bit. Let me know if you feel any tenderness. Do you feel any tenderness?
Nope.
Okay, that's good. And I'm going to check your bowel sign. The stomach is, the contour is flat. There's no signs of any lesions or bumps or scars. And I'm going to take a listen, starting in the right lower quadrant. All sounds were heard in all 4 quadrants, and if they were not heard, we will listen for 5 minutes in each one until we will hear them. Now I'm going to just palpate, starting in the right lower quadrant, and state the organs. In the right lower quadrant, you have the apex and the right ovaries. It would be a right spermatocord if it was a male. The right upper quadrant is the liver and the gallbladder. The left upper quadrant is the spleen and the stomach, and the left lower quadrant is the sigmoid colon and the left ovaries. Did you feel any pain or tenderness? Okay, you can pull your shirt down. And do your lower extremities. The patient's skin is warm to touch. Color is appropriate for ethnicity. No lesions or bumps. I'm going to check for edema. No edema found. I'm going to check your capillary fills on your toes. They are less than 3 seconds. And no clubbing. I'm going to check your tibial pulse. Your tibial pulse is +2 bilaterally and equal. And check your pedal pulse. Your pedal pulse is +2 bilaterally and equal. And you're going to feel me. You're going to tickle a little bit and put something in your foot. Okay. Okay, your Babunski test is negative. And could you stand up for me? Do you feel dizzy or anything? Okay, could you walk that way, then walk back? Thank you. Your natural gait is good. And could you put your arms to the side and close your eyes? There's no swaying, so Romberg's test is negative. You can open your eyes, and we're all done.